Thank you for joining the AAKP National Patients Meeting. I'm Ed Hickey, Vice President of AAKP and Chair of the Veterans Health Initiative. I'm a former Marine Infantry officer and I'm an attorney in Los Angeles, California. I'm active in the Armed Forces legal community here in California and work with the Veterans Legal Service Project of the LA County Bar Association to support the legal needs of active duty military personnel, reservists, and veterans. I'm also a former senior aide on Capitol Hill and a former senior advisor to the Director of the United States Civil Service. Like many of you listening today, I have a history of kidney disease in my family and have direct experience as a caregiver. I'm also a kidney patient and share the same sense of urgency to impact research and innovation to save and improve lives and reduce suffering. In 2019, AAKP launched the Decade of the Kidney. Our stated goal and objective is to help deliver substantive changes in kidney research and innovations in the next 10 years. In order to do this, patients must be involved in both research and communications, and we need to share our insights and personal stories more widely. Over the past several years, AAKP patient advocates have been highly successful in getting their viewpoints published in peer-reviewed medical journals. By doing this, we are impacting the research and medical communities. A major factor in this success has been our friend and ally, Dr. Ranesh Mehrotra, editor-in-chief of the Clinical Journal of the American Society of Nephrology. Under his leadership, C. Jason launched a strategic initiative that established patient voice editors and patient voice editorials. Based on metrics that measure media and social media impact, the patient editorials appearing on C. Jason are among the most impactful that C. Jason has ever published. We thank Dr. Mehrotra and his C. Jason team for elevating our voices across the kidney community. Beyond medical journal, AAKP patients and allies are also impacting public and policymaker perceptions about the role of patients in kidney science and innovation through published books. And that brings us to our panel today. The individuals you will listen to in this session are AAKP members, board members, and allied medical professionals who have used their talents and the power of the written word to author well-received books and forthcoming books. Their topics range from kidney science and learning to very personal and emotional stories about their direct experiences with kidney patients and kidney disease. Each of these authors has our deep respect for their intellectual honesty, courage, and sheer guts to get in the public arena and share their viewpoints. I hope those of you who are watching today are inspired by their example. I encourage everyone listening to try your own hand at writing and publishing. Whether you write a letter to the editor, a blog, an article for a medical journal, or a book, the time is now to tell your story during the Decade of the Kidney. For today's session, Authors Corner, AAKP patients and affiliates advancing care, research, and shared decision-making through published work. I have the honor of conducting a series of interviews that we are privileged to share with you now.
The title of my book is Hundreds of Interlaced Fingers, A Kidney Doctor's Search for the Perfect Match. The book is about my journey from being a primary care doctor to continuing my training and becoming a nephrologist, a kidney specialist. And that was because, long story in a nutshell, when I was a primary care doctor, I met my husband who had been on dialysis for about 5 years at the time. And because of our relationship, I got a bit of an inside view of the kidney transplant system and how inequitable it can be for different groups of people. And so for him, I decided to donate one of my kidneys. And for everyone else, I decided I would continue my training and specialize in nephrology so that I could hopefully do research that would help make the system more equitable for everyone. Well, the book is very much written for the layperson. Anybody walking down the street would be able to understand it. So it is really intended for the general public. And what I hope to accomplish with this book was primarily to let people know the realities of kidney disease and all the things it entails, and particularly around dialysis, people coming to terms with kidney disease and those decisions, so that they could know that there wasn't just one choice, that they could think about what would work best for their own lives and to consider donating a kidney if that was something that was accessible to them. So all of those things I hope to give to people as just to round out their way of thinking about the situation, which can be really frightening for most people. Well, one thing I'll say, and I did write about this in the book, is it's a little bit embarrassing the way we train people. So when I was a resident physician, I trained in a hospital where I saw plenty of people who were on dialysis, but it was really just all about the numbers, taking care of the orders and making sure everything was going right in the clinical sense. But we didn't really get training in thinking about the person with the illness. And being in the relationship with my husband definitely showed that to me, that there's another side. It's not just the illness, it's the person who's trying to navigate their life with this illness. So I think that's the humanistic side of medicine, I think is, I feel like we're getting better, but that's something that wasn't stressed enough when I was going through it. And so that was 17 years ago. So we're 17 years out from surgery. I'm doing great. My husband's doing great. No dialysis since we left the hospital. And so it's really been very much a journey for me. I never would have predicted that this is where my life would have ended up, because once I went into nephrology, I realized that I did not want to continue and become a transplant nephrologist. I imagine that would have allowed me access to data into doing the research for access to kidney transplant. But at the end of the day, I'm very much a primary care doctor at heart. And what really touched my spirit, so to speak, once I was in nephrology was the end of life aspect of it, people coming to terms with having kidney disease or end stage kidney disease. And to think about that and how to support people, the lives around those conditions, is the palliative care side of it. So that really became my passion and what I focused on. And when I think about where I started, little girl in Spring Lake, North Carolina, first in my family to be a doctor, I never would have predicted that that's where things would have ended up. And still, it's just part of my journey. I'm doing so many other things now that I really think that experience opened up my entire life in a way that I couldn't have predicted, but I think was definitely where I needed to be.
I hope these interviews inspired you as much as they did me. And if you have not yet had the opportunity to read these books, I encourage you to do so and keep a lookout for those coming soon.